Good afternoon, everyone, and welcome to the Henry Schein Dental Academy webinar series. My name is Adam, Marketing Specialist, and I'll be your moderator. Today, we're welcoming back Jamie Collins as our speaker, as she will share go-to strategies for a steady referral stream. Before we get started, we have a few reminders. At any point during the webinar, we do encourage your participation. Please type any questions you have into the Q&A section of your control panel, and we'll answer them live at the end of the presentation. Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand. And this webinar is sponsored by Henry Schein's Dental Business Institute, as well as TeleDent by Mouthwatch. Jamie, I will throw it over to you.
Wonderful. Thank you so much. And so topics today we're going to look at are your referrals falling through the cracks, and maybe some strategies that we can use to implement and increase that referral base and that success. As I said, my name's Jamie Collins. My email is there at the bottom. Should you have any questions, you are always available to reach out at any time. My background, I've been 22, almost 23 years in the dental field. I've worked as a hygienist. I do work as a KOL and subject matter expert for various companies. I've worked heavily in education and course development. I've been published over 70 times in different publications. I've also worked as a contributing author to multiple textbooks with Elsevier. I've worked heavily in dental coding and creation, providing testimony to the ADA and the CMC. And then I am the professional education manager, senior client success manager at Mouthwatch. When we think about referrals and the opportunities and the limitations that we have, we're going to look at some ideas of looking to bring new patients into your practice using technology. We're also going to look at the aspect of using teledentistry to strengthen that referral process and how we can provide our patients with faster access to care and evaluations, and how teledentistry especially can help save time and increase your efficiency in care coordination. And lastly, how we can use it to communicate with medical and dental peers by using teledentistry and really close that loop. COVID really has brought forth teledentistry into the mainstream of dental practices. And there was a recent study published that felt 46% of dentists said a drop in revenue has been the #1 impact on their practice as a result of COVID last year. We all know that practices were shut down anywhere from 6 weeks to 3 months, sometimes more, depending on the area. But we also know that 40% say that, again, that revenue had been the biggest challenge going into 2021, that loss of revenue and the cost associated with providing care. 19% said the cost of PPE has been the #1 impact on their practice. Finding it and supply and demand. Cost of gloves, cost of masks, cost of cleaning supplies has all gone up because of the demand right now. However, 22% said there's new opportunities as a result of COVID, and that includes using teledentistry. 42% of US adults delayed or avoided seeking dental care completely while we're in this pandemic because of concerns of contracting COVID. As a result of that, 1 out of 3 dentists who are solo practitioners say they're not busy enough. 1 out of 3. And I'm sure, like many, you may have seen a decrease in the care you're providing or the patient population that you're seeing. It's important to note that 70 to 80%, depending on the study you're looking at, only 70 to 80% of patients have returned to the dental practice compared to pre-COVID, when we compare month to month. As a result, Some general dentists are not referring as much treatment out to specialists. They're keeping it in-house on a case-by-case basis because they're not busy enough, because we're not seeing as much. And much of that comes down to referrals. Our specialists depend on referrals from our general practice. Our general dentists rely on referrals from maybe a mobile hygiene or a collaborative agreement. And we also rely on referrals coming from our patients, referring other patients to our practice. And how can we make that stand out, close that referral loop, and ensure that patients are getting the best care possible and building our business back up in the same time? One of the things we can do to help is create a structured referral plan. Have these standards in place when you conduct a referral, maybe outside to a specialist, on how these are going to happen. This helps ensure that we're not dropping the ball somewhere along the way. So that referral should be placed or could be linked to our existing EHRs. We need to specify the reason for the referral and any relevant clinical information. Are you sharing more than just x-rays or images? Are you also sharing the medical history, medications with this? The biggest key to a successful referral practice is communication. Communication between the practices, communications between the practice and the patient. We also have to create that value and that need of care for that patient to follow through. The ADA has issued a guide, basically their guidance on elements of dental patient referrals. We know that we need to have the name and the address, that demographic information for the patient. We need to have a scheduled appointment date and time with that specialist or other consulting dentist. What's our reason and our diagnosis? Many times I see or have seen in the past, Mrs. Jones, we're going to refer you over to the periodontist. And you see a staff member rip off the page from the pad for the periodontist and hand it to the patient and say, just call them. None of this information is filled out. The periodontist then gets a phone call and they don't know what they're seeing the patient for. They're going in blind. So then they're having to call your office. And it takes more time on everyone's part. That reason for the referral and the diagnosis should be part of that. Maybe we need to include that general background information about the patient, which may affect the referral. Is this endodontist seeing this patient for a retreat? When was that original treatment completed? Many times too, we need to have that authorization to release records in place from that patient. We know that you can get in trouble if we're not sharing the correct information or we don't have the correct permissions in place to do so. Medical and dental information. This may include our medical consultations for a specific problem. Maybe there's something part of that medical history that's contributing to the reason we're referring the patient. Do we have diagnostic casts, radiographs, digital images? These all come into play as part of your referral process. And maybe we're looking at future treatment needs. Are we referring them for a specific reason to come back for a larger treatment plan? And then the urgency of the situation. Is it urgent, or is it something that can be waited and we're planning for in the future? We also need to note any information that we've already provided to the patient. So this is quite the list that we have, and maybe there's a better way to do it than just tearing off that piece of paper on that pad and handing it to the patient. The ADA also has a guide for communicating from the dental provider. That initial report from the specialist or consulting dentist needs to indicate that preliminary diagnosis and anticipated treatment. How many times has your practice then turned around and had to call the specialist to say, okay, what was done? What was your diagnosis? What's the prognosis? And what do we need to do next? Or we're waiting for that to be delivered in the mail, in that little postcard form. It may be the fact that it got dropped and you didn't get that report. Therefore, we don't know we need to get this patient back. And they're out there wandering around with a temporary filling in that endo access hole that's going to compromise that endodontic treatment because we're not getting a permanent restoration in place. So we need to have that. We need to have that coming back from the specialist. With it, we also need to have any progress reports. If treatment is extended over a considerable amount of time, what's our latest update? And then again, that final report. This may be factors that are going to affect them in the future. This may be the prognosis. Does it have a guarded prognosis? Or is this tooth hopeless? Do we need to look at alternative treatments? We're also looking at the diagnostic quality of the copies or duplicates that are sent back and forth. We can use teledentistry, for example, to capture images or upload our x-rays into it and let that specialist have, or that general dentist, have instant access to that documentation. And then if we've sent certain things over, maybe it's a hard copy of an x-ray, not a duplicate, we need to make sure those are returned to the proper place. But what are the patient barriers? How many times, and stop and think about it, how many times have you sent a patient home with a referral? Mrs. Jones, you need to call them and schedule an appointment. We see them back for their next recall 6 months later. We say, did you go? And they go, no, I lost it. I need another one. And we repeat this process, maybe for the next 2 years, 2.5, up to 3 years. There is that barrier in place, and we need to know how to address it and ways around it to ensure we're closing that loop on referrals to another provider. These barriers may include transportation. It might be the lack of time. How much time are they having to take off work to travel or just take off work to do another evaluation appointment and screening? It may be a language barrier. Insurance plays a big part. We often hear from patients, well, we're only going to do something insurance covers. Your insurance coverage should not dictate the treatment that you recommend and the treatment that's provided. We have to find a way to create that value. And once that patient sees the value, that insurance barrier often becomes not a barrier anymore. And it goes hand in hand with affordability. So when we look at affordability, the cost of treatment, this is also where we're looking at treatment alternatives. But one of the biggest things I hear in clinical practice when we try to refer a patient over and over and over again is trust. They come back and they say, well, Jamie, I know you. Can't you just do it? I don't want to go see somebody I don't know. Same thing to the doctor. Doctor, I know you. I know you want to send me out for this root canal, but can't you just do it because I don't know them? So we're looking at a way and how can we create that trust and encourage them to see a new face, a new provider, and moving forward with the referral process. And really there's a great avenue that we see with teledentistry and how this closes the loop and how it does it very successfully to some of the more innovative dental providers in our country. When we look at it, they have instant access to reports. With our TeleDent software, we're cloud-based. So anyone with a connection can see anything that the other one is putting in real time. We have access to images and x-rays, all the documentation, all with that clarity and quality that we need to have. We're creating that trust and relationship, especially if we can make a very high-touch handoff from a general practice to a specialist, or maybe back and forth. And no more lost paper referral slips. So when we're able to check in with a patient each time they come in, again, and we ask them if they've gone, and they go, no, I lost it. I need another one. I don't remember. And you hand them another one. Again, 6 months later, another one. Until what happens? The condition worsens so drastically that what would have been treatable easily is now a bigger problem and a much more costly problem. The other thing we have to consider is your liability risk. If you are not following through and doing multiple efforts on this referral, you may be held liable, you may be held accountable if that patient chooses to file a complaint. As dental providers, we can't just hand them the slip and expect them to go. If they come back and they say, you didn't tell me I needed to do this, and file a complaint, you're hanging out there because you did not follow through. Maybe you didn't send it to the end of the specialist, and you didn't follow through with the patient. And really, even we document the best we can, we need to be able to prove that. So one of the ways we can do that and have that high-touch handoff and that constant contact if we need to is through teledentistry. So really, I hear too, what is teledentistry? I know I can call, I can FaceTime. We can do this with our patients. So why do we need to do anything different? And really, teledentistry is just a form of telehealth. We see it in our telehealth, our teledoc. If we have private pay medical insurance or group medical insurance, you may get your teledoc card in the mail saying we can do this through telehealth. Teledentistry, I often hear from people that say, Jamie, dentistry's hands-on. There's no way you can do it. It's not effective. And actually, it is very effective in many ways. It does have limitations. However, it does have some great benefits, just as a regular telehealth visit does too. In fact, with our society using telehealth so much more, and some using teledentistry, patients are starting to demand it because they're recognizing the convenience of telehealth services. So how does teledentistry work? There is two main ways, one of which is synchronous. This is our real-time audio and visual video call encounter, much as we're doing right now. This is really effective when we look at consultations, treatment plans, limited oral evaluations. It is really impressive what a patient can capture with a smartphone if they need to, with a little bit of guidance. And then there's asynchronous, which is our store and forward method. This is how many of your referrals will take place. And it's where one provider uploads the information and can transmit it to another provider. Or the patient can upload information again and transfer it to the provider. Both of these manners are very efficient when we look at it. As I said, that real-time synchronous encounter is that video call, that video conference. With TeleDent, We can record it. We have a patient record of it, and it becomes part of that patient chart. Same with asynchronous, that store and forward. Any interactions regarding the patient or interactions with the patient is going to be part of that patient record and part of that patient chart. Again, when we talk about liability, we need to have those records. And especially when we're looking at referrals and moving forward on those as well. So what was teledentistry? It really originally was thought to be more of the community-based service, health fairs, essentially that moving on. But really, it does so much more. When we look at what it is now and the adoption of teledentistry, we see it connecting patients to providers. We see it connecting providers to providers. In the referral aspect, I see it used very well with oral surgeons as well, because the general dentist is often the one taking the cone beam or the panel and making that referral, even with oral cancer screening. So then the oral surgeon has the documentation they need to treatment plan and do that consultation via teledentistry with that patient, and then get them access to that care sooner. So no coming in for a physical hands-on treatment plan presentation. And this can happen with every general dentist, every specialist. It's a way to close the loop. We see other benefits when we look at it as well. We see benefits of increased access to care. We have earlier treatment. And then the decreased financial burden when we take it virtual versus hands-on. There's some very clear benefits of it as well. We see intra or interpersonal professional communication. Maybe you don't need to see that other doctor for a lunch date to be able to discuss patient need. We can all join in via the same call and do it all together. Comprehensive care. We're able to collaborate. Again, maybe this patient is coming from the general dentist, needs to see an oral surgeon and an orthodontist. We can collaborate together, ensure we're getting comprehensive care for the patient in the best way possible. It also provides us with revenue potential. We have 2 teledentistry codes, but I bet you didn't know that there's additional codes new as of 2021, which we'll get into here shortly, that are billable for that as well. It provides more flexibility in what we're doing and how we're seeing patients. And again, that continuum of care is very, very important. When we talk about it and using it for referrals and using it for specialties, there's no specific license or credentials required to utilize teledentistry services. It is considered part of your Dental Practice Act if it is allowed the state you're in. The majority of the states have legislation in place or are currently working on it at this point. However, it's very important to note that you can only provide care in the state you are licensed in. So I live right on the border of 2 states. I couldn't provide care over the border if I was not licensed in there, even though it's only 4 miles from my place of business. So that is something we have to ensure that we do to protect yourself and protect your license. Now, some states are beginning to require a telehealth training to be able to provide any sort of telehealth visit. Washington is kind of leading the way for this. I actually presented a course to them, a telehealth certificate course last week, but they are providing, requiring training to provide these services to ensure you are protecting the PHI and taking all necessary steps and know the limitations as well as the potential of any telehealth visit. So let me ask, are your dropped referrals turning deadly? We know that oral squamous cell carcinoma accounts for almost 90% of all oral cancer diagnosis. It can be increase your risk by smoking, alcohol consumption. We know the HPV virus is playing into this as well. And this recent study that came out said 55% of oral cancers were referred to the surgeon by a general medical practitioner. 44% were referred by the dentist. When in fact, many times, how often do we hear or we see a patient and we say, something just doesn't look right. I want you to go see the oral surgeon for evaluation. We hand them the paper slip. And they don't go. And they don't go. This happened to my office recently. They didn't go. We saw the patient back 2 years later, hadn't seen him since, with half of his tongue removed, half of his jaw removed, because it was oral cancer. He ended up going to his medical doctor, who then sent him to the surgeon. We often hear from oral cancer survivors, they've gone to their medical doctor, and the medical doctor said, "Oh, it doesn't look like much. Don't worry about it, or just go see your dentist." How else can we close that loop via referrals? Many times, if we have a relationship with medical and physician, we can get that referral from them. We can even do that real time with teledentistry as well, if need be. Both of them experience similar delays, and according to this study, on average, patients went in for two or three consultations for the issue before they actually got the referral. So think about the implications of dropped referrals and how we can close that. We know an intraoral camera serves that purpose for more than selling dentistry. X-rays won't show us soft tissue lesions, but we can use our cameras, and you should be using your cameras to monitor this and to be able to see that change and referral for biopsy. We can also send these intraoral images to be able to go forward and make that referral and document any changes from baseline. Soft tissue lesions, we often see leukoplakia, fibromas, lichen planus. Gingival recession is huge. You can't see that on the X-ray, but we can use those cameras to document, to do so, and make those referrals. If we're referring to a periodontist for perio conditions or recession, we can do it through teledentistry and share all of those images and close that loop, and maybe treat it when it's 3 millimeters recession rather than wait till it's 6 millimeters and they end up losing the tooth. Geographic tongue, again, oral cancer, papillomas are huge. We talk about oral cancer and the needs. Mouthwatch is hosting a webinar on Wednesday night from one of the leading experts in oral cancer screening. And we're going to be looking at that. And that's something that they talk about as well. With TeleDent, we also have the patient-facing messaging via the patient portal. When we have that loop with the specialist referral, we can connect the specialist, the general dentist, and the patient to ensure everybody's on the same page. We're sharing messages, images, files in a secure, encrypted, and password protected way. So we're protecting that PHI and ensuring HIPAA compliance, much more than if we did it via something like FaceTime. The patients can attach images and documents from their cell phone, from a camera, from a webcam. And then we're getting that real-time notifications, even when that patient's offline. So if I have a referral coming in from you as a general dentist, I'll get notification there's something to look at. I don't have to continually check it. And so it's a convenient way to close that referral process and ensure they're getting that care sooner yet again. There's benefits to the provider as well. We have that patient-facing communication. We can screen patients. We can screen them for necessity of treatment. We can screen them for urgency on treatment. Now we can even do the COVID screenings and the questionnaires before they step foot in the office. And we can authorize prescriptions as well. If it's in a state, you're allowed to do that. We're providing that oral health support. I have specialists who are using it to, a periodontist, for example, as part of his oral hygiene program before any of his patients go into surgery. They're implementing that with teledentistry. And then it's a way to also reach future patients, as part of a community resource. It says you're integrated within the community. You're looking at different ways to provide care. And again, we're seeing patients are starting to demand a different way to be seen for something as simple as a post-operative appointment. Video conferencing, again, that real-time face-to-face interaction. With referrals, we often see this happening from the general dental chair to the specialist. We can do that initial consultation from a distance and able to look at that again, pre-treatment, post-treatment. We use it to evaluate the need for care. But then we look at how to increase your patient referrals to your practice. This is another thing. If only 1 out of 3 are saying that they're busy enough or they're not busy enough, how are we going to increase that patient load coming into our practice? One way to do it, we thank patients for referring others. We provide rewards. I've seen offices that are doing this and increases the referrals by something as simple as, well, it may be something as simple as a branded coffee cup as a thank you. And they rave about it. They use it. We know word of mouth is best. And actually 90% of patients found a new dentist by either word of mouth or by internet. So 90% of us find our healthcare providers that way. 63% were word of mouth, recommendations from other patients. Roughly, depending on the study you look at, 40 to 60% of patients will refer another new patient to you within a year. We need to be able to ask for that. Also ask for reviews. Google review. Hey, can you leave us a Google review? That's going to up your Google standing, and patients look at that. I know I look at those when I look to go someplace new or looking for a different provider. I look at those reviews on restaurants. This is how society finds these today. And if we can streamline the experience, rather than them coming in and spending 2 hours in your dental office with that first 30 minutes filling out paperwork and discussing it, maybe there's a better way to do it. We have them submit it through the portal. We can connect with the patient via face-to-face encounter as we are now at a convenient time for them without leaving home before they ever have to come in. They're going to tell their friends. We want to make that patient loyal to you. We're going to elevate that experience. We're going to optimize it. We want to look at our internet presence too. Remember, they're looking online. Encourage those reviews too. In fact, are you looking at your social media? Are you picking up your social media game? 75% of adults age 18 to 24 and 57% 25 to 34 use social networking sites. Many of us ask for reviews or recommendations on services we're looking for. Dentistry is no exception. 61% of adults gather health information online. That's not a surprise to me. 37% use social media to find information on healthcare. Again, 38%, up to the other one said 40, 47, 43%, look online for information about hospitals or medical facilities. I know I do, and I bet if you think about it, you do as well. And I guarantee your patients do. 51% of dental practices are using social media currently. Facebook, LinkedIn, Twitter, YouTube. I know my old dental practice, we used it all the time. And that practice grew leaps and bounds. We had to move into 2 new buildings in a matter of 7 years because we were bursting at the seams. Social media influence should not be underestimated. Use it to ask for referrals and use your patients in that way as well. And then alter your workflow. As I said, if we can cut down the time that they're in our chair physically with stuff that we can do via teledentistry, they're going to share that convenience with their friends. They're going to talk about it. Many of us have offices that already offer web forms to fill out. We can do our medical history and our HIPAA online. Maybe we have a scheduling calendar where they can do an appointment request online. TeleDent has a patient intake form where new patients can request an appointment and give the reason for the visit. Maybe when you look at that, you see that maybe they would be better served with a specialist, and you can go straight to that referral process as well. And we want to give those patients an option, because if we give them options, again, they're going to refer their friends. We're going to use live video consultations. They can message us securely online. They can have access to a patient portal. So if 5 o'clock on a Friday night on a holiday weekend, they're concerned about their child's 6-year molar coming in because it's the first they've noticed it, you can connect via teledentistry, do that initial screening, and decide whether you need to see them in clinic or maybe you need to go straight to the referral, at which point you can loop in the specialist. And many times too, I'll hear, yeah, this all sounds great and wonderful, Jamie, but what do patients think? What's a patient going to say dentistry is hands-on? As I said, it's very much a hands-on profession. I love dentistry. I've been in it for 20 some years. However, using teledentistry as part of your practice and part of your referral process, they've looked at some studies and there's been some great ones come out. 97% satisfaction rate for patients with virtual dental visits. 96% said they use it again. And out of those, 33% of teledentistry encounters did not require an in-office visit. That 33% is a statistic that comes from DentaQuest here in the US. And they looked at patient experience for the top 2 numbers. They look at the improvements that we have, reduced travel time, improved engagement. We find when we can connect them and close that referral loop and make them involved in care, they're more engaged. We have treatment plan presentations and understanding. They can involve the other decision makers in the household with them. Many practices right now are only allowing the patient only to come into the practice. Again, we hand them a slip of paper, that treatment plan. Mrs. Jones, here's the 3 crowns, 2 buildups, and 3 fillings we need to do. Does she schedule right there? Or does she say, I'm going to go home and talk to my husband? And what does he do? He picks up that paper and goes, that's expensive. We're not doing that. Okay, so he doesn't see the need and he doesn't see the value. Conducting a treatment plan presentation with the decision maker and sharing images via the screen like we can today, being that patient portal, is going to create that value, create that urgency, and improve your case acceptance. And in turn, they're getting earlier access to treatment as well. They're understanding their needs, they're understanding the plan, and they're understanding the why. They're going to do it. And then also looking at the convenience of it. We're a busy society. We like to get out, we like to move around. And finding time sometimes is one of the common barriers. Looking at the previous study where we said a 97% satisfaction rate, 79% did not have any previous telehealth experience prior to that study and that event. But 91% said they can understand the system well and maintain communication with their provider. In fact, many of them felt they had better communication because they were able to have their provider's undivided attention during that time. Ease of use, effectiveness, it increased their access to clinical care. This is something to keep in mind when we look at access to care, healthcare provider shortage areas, and almost 60 million people in the US are considered living in rural counties. They have to travel for care. They have to travel many times even further for specialized care and referrals. If we can close that and do the initial consultation via teledentistry, they're more apt to follow through with treatment. They're more apt to go see the oral surgeon whose office is an hour and a half away from them. When the oral surgeon says, yes, we need to do something about this, rather than them coming to your practice 3 or 4 times and then it being too late. So it's a useful benefit to the patient and the provider. We see lots of it with mentorship and education. We're doing a lot of the referral programs in dental schools as well. Dental programs, specialty programs are using it to refer to one another. We also see it with more experienced dentists getting the referrals from maybe the newer dentists out there that aren't confident in treating, or maybe it's not their area of expertise. That secure data review, that consultation that we see as part of the referral and collaboration process is not to be underestimated either. So there's some key telehealth takeaways when we think about it. Not only closing that referral loop, but we're looking at cost savings when we use virtual care. PPE preservation, efficiency. The average telehealth visit is 15 minutes versus the average limited oral evaluation in office is about 30 minutes. Much of that time is cleanup and resetting up the room. Patient safety, provider safety, reduced time in the office. It's also a billable procedure. If you're doing an evaluation in the office, you get paid on one code. If you're doing an evaluation via teledentistry, you get paid for that evaluation code. And many times you also get paid for the teledentistry code, both. And so it's always used, teledentistry is always used in conjunction with the service we're providing. It is never, never a standalone code. I hear from providers who said, I billed it, I didn't get paid on it. When we talk about it later, they say, I only billed the teledentistry code. I didn't bill the evaluation. There is a way to do that. If you want more detail, please feel free to reach out to me, but we see it for limited, we see it for reevaluation of problem areas, post-operative visits, periodic exams. It's also approved that we can use it for dental case management, that care coordination that we're seeing between multiple providers. I do want to go back, however, there is new codes for 2021, image capture only codes, where you can capture the images, send it to your other provider. It's also even with intraoral images. Send it to the other provider, that specialist, to provide the evaluation. And reimbursement and legislation is really accelerated, mostly as a result of COVID, even though it was in place before. We see companies like Aetna, Liberty, MetLife, Principal, the Deltas, Guardian, Emeritus, Sun Life, just to name a few, that are reimbursing on those teledentistry codes. You also want to know when there's more than one provider who's providing the care, who bills the teledentistry code, who submits it. So it's the dentist who's performing the oral evaluation, makes the diagnosis, and makes the treatment plan, is going to be the provider who reports the CDT codes. So if I'm a general dentist, I'm referring to you as a specialist. You are making a diagnosis and making the treatment plan. You will be billing the teledentistry code. I can bill for image capture, everything that I send to you. And really, it's much easier and less complicated than many think it is. When we're doing that review and treatment planning, and we're sending as part of our referral process, all we need is a computer and an internet connection. If you're a dental provider capturing these, yes, I recommend using an intraoral camera. If we're connecting with patients, they can capture with their smartphone and they can do it very well. There are some key points to consider when we're using teledentistry and software as part of our referrals or in general connecting with our patients. We want to use a program that is help us remain HIPAA compliant. So it should be secure, encrypted, and password protected. You want to look at your State Practice Act as well. Are you allowed to do teledentistry in your state and in what capacity? And then technology. Recommend using a cloud-based software that allows you to practice no matter where you're at. It'll allow your specialist, your general dentist, maybe your mobile hygienist to all remain connected at the same time. So we see it in a variety of ways. We see it patient-facing. We see it collaboration with teams and multiple providers. We see it used very effectively in specialist referrals. Part of our lab consultations as well. Shape, shade, many times those will happen through that. Medical dental integration, we're seeing more and more of that. Everything is connected. Head, shoulders, knees, and toes. It's all connected. And we're seeing more physicians and medical facilities starting to refer to dentists and starting to collaborate with dental programs, especially when we look at rural areas too. We see it with new patient intakes. We're doing that initial meet and greet via teledentistry. We're creating that trust when we're sending our patients to a specialist. They're connecting with them and feeling comfortable seeing somebody that you trust to care for them. Everything from mobile dentistry to public health programs that increased access to care. We also see it as a way to capture lost patients. These can be our patients that are lost in the world of dropped referrals. These can be our patients that are reluctant to return to practice because of COVID or because of one reason or the other. Emergencies, children. We know it saves on PPE because we can't catch anything through a computer screen. But it also provides an alternative business model and how we're conducting care and how we're reaching these patients there as well. We see it in ways of in-office teledentistry. So if you're seeing new patients come in as part of the referral, our hygienists can capture that images and that data And the dentist can review and connect with the patient via teledentistry to provide that treatment plan and diagnosis if needed. And that way it leaves more chair time for production and restorative procedures rather than solely for limited evaluations. We can do our initial consultation via teledentistry if we're a specialist and schedule that patient accordingly rather than having multiple appointments for them to come in. It provides us a way to stay connected. So we're protecting our patients, we're following up on these referrals, and we're protecting our practice from liability risk because we're doing everything possible to close that loop to ensure we're seeing them and to ensure they're following through on that referral. So to summarize, in implementing teledentistry, it gives us a way for less dropped referrals. It's risk mitigation. We can use it to increase our patient base. Other patients are going to refer new patients to you because of the technology that you offer. And we're going to capture those lost patients that maybe we haven't seen in a while. And then it provides that revenue potential. Again, with teledentistry, we have more than one code to bill for. As we mentioned, and as part of a thank you with Henry Schein as well, I do work for TeleDent by Mouthwatch. We have multiple things with this. They're happy to set up, contact your Henry Schein, and see about it. We have patient management, patient portals, secure encrypted video conferencing abilities, as well as that asynchronous ability. We can share and close that loop with referrals. If you have questions, please feel free to reach out to me, jamie@mouthwatch.com. Any questions in the Q&A box or the chat, and we'll go through and answer them.
Awesome, thank you. I know we get this question a lot about teledentistry, and I apologize if you mentioned it earlier and I missed it, but what platform can I do teledentistry on? Like Zoom, Facebook chat? Like is there a limit as to what I can and can't use?
Absolutely. Absolutely. Because the ADA, in the height of COVID, when dental practices shut down, they temporarily relaxed the HIPAA requirement to allow you to use a couple platforms. However, it's not recommended to use the Facebook Live, any of those that can be easily hacked. Recommended, again, using encrypted, password protected, something that's going to protect your liability and your patient PHI, like TeleDent, that we have here at Mouthwatch. And as part of it too, it creates that patient record and that documentation. So if you ever have to go back or there's a complaint and you have to prove your reason for prescribing or whatever it may be, you have that patient record in that platform. Zoom doesn't offer you that. Many of these other ones don't offer that patient record and that documentation.
Great. Well, that is all the questions that I'm seeing. So we'll wrap up slightly early here. So Jamie, thank you for your time. Great content.
Wonderful.
As a thank you for attending today, everyone will receive the recording of this webinar via email sometime later this week, so keep your eyes out for that. If you'd like to learn more about future Henry Schein webinars, visit henryscheindental.com/webinars to view our upcoming schedule. I would like to thank you all for joining us and hope to see you back here soon. Have a good night.
Thank you.